Hello again everyone, welcome back to the channel, and in today's video we'll be discussing the pathogenesis of tuberculosis and the outcomes following the initial infection. Tuberculosis is caused by the bacterium Mycobacterium tuberculosis, and this is an aerobic bacillus. It has mycolic acid as one of the components of the cell wall, and this makes it quite resistant to the immune system. As per the World Health Organization figures, there's 10 million new cases of TB diagnosed each year, causing about 1.5 million deaths. This makes TB the world's leading cause of death secondary to an infectious disease. A staggering 25% of the world's population has TB infection, although about 5 to 10% of these will fall ill with active disease. TB is spread from a person who has active pulmonary disease when they have Mycobacterium tuberculosis aerosolized in their respiratory droplets. So when they cough, sneeze, or even talk, another non-infected person can contract TB by inhalation of these droplets. So let's say this patient gets infected with TB and the bacteria reaches the periphery of the lung in either the mid or the upper zone, as it usually happens. It will then reach the alveolus, and over here the alveolar macrophages are going to be invaded by the bacillus, and this will trigger an inflammatory response. This comprises of T cells, B cells, and fibroblasts, and at this point the accumulation of all these cells is referred to as a granuloma. You'll also have T cells secreting cytokines, which activate more macrophages. And these macrophages can fuse together to form something called giant cells, okay? Dead macrophages and giant cells accumulate as necrosis at the center of the granuloma. And to the naked eye, this tuberculous granuloma looks like cheese, hence the term caseous necrosis. Over here is an illustration of the caseating granuloma. At the center, the yellow area looking like cheese is the central necrosis, surrounded by epithelioid macrophages, and at the periphery there is the cuff of lymphocytes and fibroblasts. It's worth bearing in mind that the first area in the lungs which gets infected and triggers an inflammatory response is known as a Ghon focus, named after the Austrian pathologist Anton Ghon, and if you have lymphadenopathy in the hilar region, then together this and the Ghon focus is known as a Ghon complex. Okay? So moving on to the next slide, where we'll look at the consequences of primary TB infection. So the body can successfully eradicate the infection. There can be primary progressive tuberculosis, which happens amongst children, patients who use steroids, or are immunocompromised due to other reasons such as HIV. The body's immune response is suboptimal and it can't control the infection, and so it spreads to the other parts. You can have something called latent TB. Now, majority of the patients who have tuberculous infection have latent TB. This is where you are not infective to others, and the immune system has managed to contain the spread of the TB, and unless the patient gets immunocompromised for whatever reason later on in their life, or get reinfected with TB, can only then progress to secondary TB, also known as post-primary tuberculosis. On average, if a person has latent TB, they have a lifetime risk of 5 to 10% of progressing to post-primary or secondary TB. Moving on to miliary tuberculosis, this is quite a severe form of disease and involves the whole body. It is spread via the hematogenous route. In the lungs, the appearances are of diffuse nodular shadowing on both sides, and these resemble millet seeds, hence the term miliary tuberculosis. Even with treatment, the mortality approaches 20 to 30%. So that's quite important to remember. And lastly, looking at extrapulmonary tuberculosis, about 10 to 42% of the people with TB have extrapulmonary manifestations. And it's also important to bear in mind that patients who have extrapulmonary TB may or may not show lung complications or lung symptoms. Okay? So in the bones and joints, it can give you arthritis and TB osteomyelitis. In the heart, you can have pericarditis. In the GI tract, you can have gastrointestinal obstruction or malabsorption. In the CNS, you can get brain tuberculomas and meningitis. It can also involve the skin, eyes, and the adrenal gland. And finally, lymph nodes, which can classically in the cervical region erupt spontaneously, which is something called cold abscesses. So that concludes today's talk. I hope you found value in this video. In the next lectures, we'll have a look at the clinical presentation, the diagnostic tools used for TB, and the treatment deserves a lecture on its own. So I'll see you soon again in the next video. Bye bye.